Welcome to the Cystic Fibrosis Foundation Virtual CF Education Day, Adult Nutrition, a webcast supported through an unrestricted educational grant from Genentech. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. Joining me is Cathy Seifert, the dietitian for the CF Adult Program at the University of Washington. I want to thank everyone who submitted questions during registration that we will be answering. Welcome, Cathy. So why is nutrition important for adults with cystic fibrosis?
Well, when I was preparing for this, I saw that we have an age range from newborn to people in their 70s. And we want to make sure that you're having a nice, vigorous, healthy life at that point. Nutrition plays a big role in that you remain healthy.
So does nutrition impact lung function at all and help?
It does. When you look at the statistics from the CF registry information, what we're seeing is that your lung function is improved with better health. And one of the parameters to measure that health is weight for height, or BMI. BMI is you take your height, you weight, and you divide it by height. But you can look for those equations on the internet. It's just called BMI, or body mass index. What they see when we look at statistics is that a BMI of 22 for females and a BMI of 23 for males, those folks have better lung function. It's a better predictor of overall lung function and strength. So when you're looking at a BMI for a woman, say, who's 25 years old and is 5 foot, a BMI of 22 is 113. If you're looking at a person, a woman with a height of 5'4", that weight would be more like 135. So basically what you're looking at is good, healthy weights. Men, on the other hand, if you're looking at that, you have a person at 5'6", you're looking at about 143, and a person that's 5'9" at more like 160, somewhere in there. So basically, those are good weights. When you look at pictures in, Sports Illustrated or any of those kinds of places, remember those pictures are touched up. Those are airbrushed, and those women are not at healthy weights.
Mm-hmm. So one parent asked, as her child grows into teenage years, from teenage and makes that transition into adulthood, what are going to be the nutritional needs of her child?
One, you have to support that growth, so that requires additional calories. Throughout the lifespan, vitamins and minerals and calories and protein vary at different stages of growth. When you're looking at this transition, you're looking at, are you getting enough? Are you making sure that you're laying down enough bone mass for females, for males and females, and being able to support the growth to support optimum height growth.
So then we've got the growth. So then does an adult eat less than a child who's growing, or is it about the same? How does an adult gauge how much food they're supposed to eat?
It's a good question. And usually when people come to me, I'm seeing them usually keeping on about the same amount of calories. Now, if you've grown and you're at that BMI of 23 for males or 22 for females, and you're happy with that weight, then you may be reducing the calories by 500 or more on a daily basis. Mm-hmm. Remember, when you have infections or exacerbations, that increases your caloric requirements.
So how many calories should an adult with CF take a day? What should be their target?
All right, so when you're looking at those males and females that I was talking about, and you're looking at the woman who is 5'4", what I would do is I would take what I would normally calculate for a person's calorie needs, and it's using their height, weight, and age. And then I would add in an activity factor, 30%, 20%, whatever. And from there, because your needs are higher, because we don't expect complete digestion even with the enzymes, I'm going to add in another 50%. So that woman would be 2,500 calories for weight maintenance and 3,000 calories for weight gain. When you're looking at CF in the literature, you're looking at an increase of 10 to 100% additional calories over your peer. Males are going to need the same calculation, but it's going to be more like 3,000 to 3,700 calories. Again, 3,000 for weight maintenance, 3,700 calories for weight gain.
That's a lot of calories. What are some simple ways that an adult who's working, who's busy, maybe has a family, has a life, what are some simple ways that they can fit those extra calories in?
Right. One of the things that you need to be planning in here is snacks. So every time you have a break, you want to be having some kind of a snack. Then the other things are the CF Foundation has a pamphlet. It's called Grab and Go. There's a pamphlet or a booklet that's put out by the Dietary Association. It's called Pass the Calories. So those are good ways to look at, are good suggestions on how to get extra calories. But in general, one of the things I brought with me tonight is this little snack bag full of trail mix, and I added in some sunflower seeds to it. This is 450 calories. This is almost the weight maintenance calories that are needed. When you look at preparing cereals in the morning, use your whole milk to cook instead of the water to cook that cereal, or always using whole milk or even half and half on a cold cereal. I brought along also a plate with some food on it, and basically this is a cup of mashed potatoes, a half a cup of corn, and 8 ounces of meat. This will provide about 1,100 calories if you have the butter and the whole milk in these mashed potatoes. Now, you can use more butter in there and get more calories. You can cook your steak or your chicken breast or your fish with olive oil, with garlic or anything else like that in it, and a tablespoon will add at least another 100 calories. So that's kind of where you add extra calories to your foods.
So if someone with CF is looking to add calories, what about, soda versus milk, or potato chips, or I guess I go for that good calories versus empty calories. How does a person with CF weigh that out?
Again, I'm a nutritionist, so I'm going to go for the good calories, but the bottom line really is calories. We can do other supplements as we need to, but and so you want to be good calories as much as possible. Your fats can be olive oil or canola oil instead of the butter, if you want to get those kinds, the better fats in. But if you've gotten all the basics, you've met your vitamins and mineral needs, and you have your protein, if you have chips or you have ice cream or you have a soda, that's fine.
So moderation of some of those calories, if you're meeting your caloric needs using other foods. Okay, make sure I get that right. So someone sent in a question, and they wanted to know how much should they watch their fat intake, and is there a limit of fat intake that they should meet?
People with cystic fibrosis rarely have elevated cholesterol or triglycerides or the consequences of it, so I would say no. One thing to remember is that fat carries 9 calories per gram, whereas protein and carbohydrate only carry 4 calories per gram. So you can get a lot more calories without increasing the volume of food significantly. And that's one of the things I see in my practice, is that people have trouble getting the volume of food.
Yeah. Well, you talk about getting the calorie needs and the volume of food, and I know when kids with CF, G-tubes or tube feedings are seen more common in helping them maintain or get the calories they need to grow. How common are tube feedings for adults with CF?
They are common, but people will come most of the time with G-tubes to the adult center. Sometimes they no longer need their G-tube once they have reached that growth and they're able to sustain their calorie needs and nutrition just by eating. They can stop the G-tube. We will restart tubes. The thing with the G-tube, remember, is it takes the pressure off of you to eat a tremendous amount. You know, we were talking about 2,500 calories to maintain weight, but remember, that's only 50%. Someone might need another 50%, and that's a lot of calories for some people to get in.
Yeah. So we've talked about carbs and fats and proteins. What about fruits and vegetables and vitamins? Does a person with CF have to worry about that? I mean, they take daily vitamins anyway.
Right. You're getting more than just what's in those the CF-specific vitamin. There's more than that in food, and you're getting fiber, you're getting fluids. There's other things that aren't always packaged in a multivitamin, and we're finding out more and more, like lutein is a new one. So there's more things in food. So fruits and vegetables, yeah, it's best to have 5 to 7 servings a day, a serving being a half a cup. I might recommend more juice than fruit, because if you're having trouble with volume, then I would want to do something that's a little bit more calorie packed and not giving so much volume. That's how I'd get around that.
So you really work closely with the person with CF to tailor their diet to meet whatever their calorie and nutrition needs are.
Right.
So somebody sent in a question and wanted to know, is it feasible just through diet alone to take in the calories without having to take pancreatic enzymes for those who are pancreatic insufficient?
If you're pancreatic insufficient, no. That means you're not producing the enzymes to break down or digest the foodstuffs, the carbohydrate, protein, and fat that you're eating. If you restrict your fat intake, which I've seen people do, it's difficult to maintain your weight. You're not necessarily going to get in all your fat-soluble vitamins unless you're taking those that are water miscible. And what you're looking at here is you need to digest that food, and the enzymes are what's doing that. If you're not taking the enzyme, you're not getting the full benefit of all those calories that you're taking the trouble to eat.
So once an adult with CF has finished growing, do they ever need to change their pancreatic enzyme doses?
I have seen that, yes. They will see a difference. I'm trying to think of a situation.
Let me put it this way. How does an adult with CF know that, maybe I need to change my pancreatic enzyme dose?
That's one of the things I try and discuss with them, because, and you're all probably used to this, people are asking you about your bowel movements. Are they greasy? Are they bulky? Or, every time, we're going over all of that. And one of the things that I have found in doing that with people is that they expect a certain amount of bulkiness or greasiness, and I'm trying to tell them that no, that's not necessary. And what you can do is, by adjusting the enzymes, actually get more of a normal stool.
That's interesting to know. I know that, one person wrote in and said that their CF Care Center wants to screen them every year for CF-related diabetes. Why do they do that?
Because what we're seeing with the CF population is that we have up to 25% of the population with abnormal glucose tolerance. If your blood sugars, that means your blood sugars are not responding normally. What you might see is that you have insulin production, but it may be delayed. Blood sugars will go high. Sometimes people will report really symptoms of being low blood sugar. Remember, insulin is anabolic. It helps you build muscle mass. It helps you maintain your weight and your muscle. So if you have an abnormal process going on there, that could be a reason why you would lose weight. That's why we screen.
So does the high-calorie diet that we feed kids with CF make them more prone to CF-related diabetes?
Not that we know of at this point, and probably not. This is more of what's going on with a person with cystic fibrosis because of the cystic fibrosis gene.
So is there any way to prevent an adult with cystic fibrosis or anybody with CF from getting CF-related diabetes?
Not that I've been aware of, not that I can find. I know that we're looking at how to treat this abnormal glucose tolerance before it becomes true diabetes. We're working on that right now, looking at oral agents or whatever, but no.
Okay. So not only do they screen every year for CF-related diabetes, but they also screen every year for fat-soluble vitamins. Why do they do that?
I'm glad you asked that question. Basically, you need the enzymes to digest the fat. If you don't have the fat being digested and therefore absorbed, you are not going to absorb your fat-soluble vitamins. And calcium absorption can be decreased as well because it'll go out with the fatty stool. Mm-hmm. So we're monitoring that to make sure that you're getting adequate supplementation if it's not in your food. You know, the general recommendation is 1 to 2 CF related vitamins on a daily basis. Remember, your vitamin A is very important in your vision, it's important in your immune system, it's important in bone health, and it's important for fetal growth. Vitamin E is a very important antioxidant. It also feeds into bone health. And vitamin D is very important in relationship to your bone health as well. And if your levels are low, you can have these problems with your immunity, your bone, your vision. And what we want to do is make sure that you're getting adequate amounts daily.
Okay. So let me ask you, so a woman with CF wants to have a healthy pregnancy. How does nutrition help with that?
It's very important because it makes a difference on how the outcome of your pregnancy for a healthy child and your health as well at the end of the pregnancy. You're going to need at least 300 calories extra on a daily basis, if not more. Again, it's where your absorption and digestion is.
So should a woman with CF who is trying to become pregnant, should they take in their CF vitamins as well as prenatal vitamins?
What you want to do is, our practice has been, is to take and add 1 prenatal vitamin and take out 1 of the other vitamins. So 1 of your regular CF vitamins and the other one as a prenatal vitamin. The reason here is, and you would want to do that before you actually became pregnant, you would want to do it in the planning stages so that you get that extra folic acid. That's a big thing. You want to be planning, you want to get your nutrition in good status, and you want to have that folic acid on board so that you can avoid the neural tube defects.
Well, I'm going to throw you a little curveball because we got this great question just submitted, and I want to ask it, and I don't know that there's an answer to this. So this will be our last question, and that is, does body mass index predict lung function, or does lung function predict body mass index?
Very good. I believe, and maybe when, I believe it is body mass index predicts lung function. I'm pretty sure.
Okay. So is there any clear correlation between the two, or we don't know yet?
I think we're not really sure, but we know that they're definitely related.
Okay, well, thank you, Cathy. Remember, you can learn about CF nutrition and from your CF dietitian and your care center, and learn what you can do to improve or maintain your nutrition. Your CF Care Center and the CF Foundation's website has more information related to adult nutrition, including simple ways to add calories, information about pancreatic enzymes, bone health, vitamins, minerals, and CF-related diabetes. Additionally, you can find links to a body mass index calculator on the Center for Disease Control website, on the CF Foundation's website. There is an additional webcast that is archived on the website that talks about CF nutrition. I want to thank you for watching and submitting your questions, Cathy Seifert for answering those questions, Rick Vast and the technical crew, Genentech, and Melissa Chin and the CF Foundation for making this webcast possible.